Hello, good morning everybody. My name is Dr. Patrick Norton-Doe and I'm a speciality doctor in learning disability in Hull. I'm very sorry I can't be with you at the new Health and Wellbeing Hub in Bridlington today. Rani Rook kindly invited me to give a talk about annual health checks for people with learning disability. From slide 1, you can see that I work with the Humber Teaching NHS Foundation Trust, and my new role started there about 15 months ago. It's a unique role because there's nobody trying to set up a service where you have a doctor working with the learning disability team with a medical background. This means that I can help support people with learning disability who have complex medical health problems. And I'm going to look at how the annual health check can help to keep the people with learning disabilities really healthy. So my talk will cover 5 main areas, starting with what are annual health checks, why they're important, what's involved with an annual health check. I'm going to cover something about co-production, and I think that really feeds well into the Bridlington Health and Wellbeing Hub, because I see from the poster that you've got about the centre that it involves some elements of that, and I think it's really important. And finally, I'm just going to mention about the hospital passport, which I think will be a useful part of the annual health check to make sure that that's something that's considered. So, what are the annual health checks? These are not the same as what doctors offer to people over 40 every 5 years, when you go mostly for preventing something like diabetes and blood pressure checks. These are a much more comprehensive assessment. They've been specially designed for people with a learning disability, and they start from age 14, and you can have one every year. Not all GP practices offer them, and if you struggle to find that your surgery doesn't offer them, then you can contact the local disability specialist team who should be able to help you. They include a comprehensive assessment, not only of health issues, but also social issues and mental health conditions. As part of the annual health check, there's an opportunity for you to discuss with your doctor or a specially trained nurse about issues around your medication. We know that medication can sometimes cause problems in people with learning disabilities. In the past, medications were used to help with behavioral problems that nowadays we think are better managed in other ways. These types of medications can cause long-term health problems. And so we're keen to try and help ensure that those medications, if possible, can be reduced as part of the STOMP program. That's stopping the over-medicalization of people with learning disabilities and autism. The annual health check also gives an opportunity for the nurse or doctor to check about screening for health problems, like hypertension, a blood pressure check, sometimes checking your kidneys, sometimes checking your vaccination history, or whether you need a cervical screen. These things are very important, and I'll go on in the next slide to explain why. Finally, I've included a picture about the Health Action Plan. And this is something that I think will become increasingly important when we're thinking about annual health checks, because at the end of the process, there should be an agreed health action plan to address the different health issues and concerns that have been raised. And we'll talk about that again towards the end. So why are they so important? Well, we know from studies that people with learning disabilities tend to live shorter lives, and learning disability in itself is not a reason for somebody to have a shorter life. So we need to look at other reasons, and some of them are to do with obviously nutrition and lifestyle, but also other problems that learning disability people have in getting good health care. We know that there is inequality, so that they tend not to have the resources to have a really healthy life. We also know that sometimes they struggle to get meaningful activities or jobs, and these things affect our health and well-being. So annual health checks, we think, might help to reduce these types of inequalities for people and may help them to live longer, healthier, and happier lives. We want to try and reduce this age gap of roughly 22 years that people with a learning disability die sooner than people without. And by looking at underlying health problems and preventative things, diagnosing things early and treating them effectively, we believe will make a difference. And there is some good evidence coming through now that annual health checks are playing a role in reducing the risks of a premature death. So what does the annual health check involve? I'm not going to go into real detail, but what some of the important things is the surgery, the nurse, doctor, or receptionist will try and make what are called reasonable adjustments. So if you need reassurance about what will happen, or you need some extra time, then please just contact your surgery and explain what your worries are. We know that people with learning disabilities don't always feel comfortable going to appointments, but the surgery will be aware of that. And it's important that you don't let those kind of concerns prevent you from having your annual health check. If it's a real struggle to get in, the surgery may be able to help somebody to help you, because they are very keen to get everybody who is eligible for a health check to have one. And in the UK, over 75% of people with a learning disability have now been able to get a health check. So when you come to the surgery, the nurse or doctor will do some checks. There'll be the usual physical checks, like measuring your weight, your heart rate, blood pressure. They may want to do some urine or blood tests, particularly if you're on some tablets. They will be able to discuss your current health and also explore how you can keep healthy. They'll listen to what your concerns are and try and find ways that they can help you. This is very much about a personalized approach. It's not about being told what to do. Those kind of days are long gone. And it should now be about sharing information in a way that you feel comfortable with, and asking about what's your main priorities, what's important to you about your health and what you'd like to do. The nurse may ask you about some common health problems that people with learning disability are more prone to, such as constipation, epilepsy, or swallowing problems. Simple problems like constipation can often be managed by attention to the diet or drinking more fluids. And a nurse will be keen to help support those kind of approaches. But they'll also be looking for opportunities to pick up the signs of more serious illnesses that, if found early and treated, are much easier to manage. She might mention about epilepsy if that's one of your problems, or perhaps swallowing difficulties or problems with dry eyes. There's lots of different conditions that people with learning disabilities are more prone to, and they will be experienced and will explore these with you. I've mentioned already the medication review and vaccinations. The other thing I'd like to mention in particular is about how you're feeling. This is really important because obviously it's not just about your physical health, it's also about mental health as well. And we want to check whether you need any support in that direction. And I think this is something where the Wellbeing Hub might be really able to help, for example, with access to social prescribing and things like that, where people concentrate not just on the health things, but on your well-being. Because we know as doctors that that's a critical thing in you keeping healthy. Follow-ups and carer support. This is important to check. So the nurse or doctor will be able to check when your next appointment is and make sure you're getting the right follow-up for your conditions. For children from age 14, they'll also look at transition. This is the time when you lose touch with the people who've been looking after you as a child and move into the adult services. And we know that people with learning disability find this a particularly difficult time. That's why it's really important to start with these annual health checks as early as possible, and these concerns can be aired and supported. My role is becoming more involved with this type of work, and this morning I've been working with the paediatric consultant here in Hull, beginning to support a child with learning disability who's approaching adulthood. This is a really important step forward, as we know that this is a difficult time and we're doing our best to try and address the challenges that it brings. Finally, I've put in bold here, create a health action plan. What's all that about? So the health action plan is really the summary of all the problems that have been identified, the issues that you're concerned about, that the nurses wants to follow up. And it should be done in a way that you understand and agree to help you plan your healthcare over the following year. There may be some need for extra support. Perhaps, as I mentioned before, somebody in the social prescribing team might want to help support you to access other activities, perhaps a group that you could go for advice, help with accessing benefits, things like that. So social prescribing I see as a very important part of the health action plan, and your nurse and doctor will be able to direct you to the appropriate people that can help. I see the health action plan very much as a co-produced piece of work. It really has to identify the main issues that are important for your good health and that you want to address. I also mentioned the hospital passport. Now, this isn't a fixed part of the health action plan, but it's something I found as a specialist doctor with learning disability. It can make all the difference if you've got an up-to-date hospital passport and you need to go into hospital. The hospital passport will explain what reasonable adjustments are needed to be made by the hospital to make sure that your needs are identified and any adjustments are made to help you have a proper stay in hospital and make sure nothing gets missed out. One common example would be needing more time or needing somebody to be with you that you trust and that can help explain what your needs are. So this is part, in my opinion, of what a good health action plan will include. If there is a chance that you could be admitted to hospital, it's important to get that sorted. And this would be a good opportunity to start thinking about that. So I'm hoping to join you later on today, and I'd be happy to ask any questions when I come. But if you can't stay, or I miss you, or I just for some reason can't make it, I've left some contact details on this slide. There's the number of Townend Court where I work. There's my email address, and also the website is available as a link. And I'm happy for this presentation to be shared with the delegates. And I really thank you all very much for spending some time listening to me. And I look forward to meeting you this afternoon, all being well. Thank you very much.